Thank you, Sandrita and Amy, for providing us with some excellent low vision resources. I will now like to invite Karen Brahm and Kurt Brunner. They are providing low vision services at the local VA here in Madison, and they will be talking about tools for patients with vision loss. Welcome.
Thank you for the opportunity to talk with you this morning about some services that are available for veterans with vision loss. So I've been at the Madison VA for about 8 years, and when I moved here, we started the low vision program that we have. Today we'll talk about the history of low vision services in the VA and the types of services that are available in the VA, including what happens during a low vision exam, and then we'll talk a little bit about our VIST program for legally blind veterans. We have no financial interests, and we do not endorse any low vision products that you may see in pictures on the presentation. Low vision services have existed in the VA for over 60 years. In 1944, President Roosevelt made a commitment to the U.S. servicemen blinded by war. He signed an order which declared that no blinded servicemen from World War II would be returned to their home without adequate training to meet the problems of necessity imposed upon them by their blindness. In 1948, the first blind rehabilitation center opened in the United States in Hines, Illinois, and it was designed to address the needs of traumatically blinded servicemen and women returning from World War II, and this blind rehab center is still in operation. In 1967, the visual impairment service teams were developed, and these teams coordinate outpatient care for eligible blinded veterans. In 1998, there was a blind rehabilitation gold ribbon panel that was established to kind of review the current VA low vision programs and to address if they were still able to maintain the world-class care for blind and visually impaired veterans. As a result of that review, in 2008, 55 new low vision clinics were opened throughout the country, and they were established as a continuum of care type clinic where they would provide a range of services to veterans depending on their unique needs. And the new programs aim to keep those with early vision loss active and integrated in their families and communities. So a few demographics. According to the Veterans Health Administration, there are 1 million visually impaired veterans and about 157,000 who are legally blind. And that is best corrected vision, worse than 2100 in the better vision eye. And these numbers are expected to increase as Korea and Vietnam era veterans develop age-related vision loss from certain age-related eye disease. The primary causes of vision loss include macular degeneration, glaucoma, diabetic retinopathy, and cataracts if a patient is unable to undergo cataract surgery. Less common causes include optic nerve diseases or service-related injuries and trauma. So there are a lot of different types of clinics in the VA for low vision. This slide talks about the outpatient low vision clinics. So basic services should be available at all VA eye clinics. Every clinic should be able to provide basic services such as providing a veteran with a simple pocket magnifier or making their reading prescription a little stronger in their glasses to help them read easier. There are 22 intermediate and 22 advanced low vision clinics that are spread throughout the country. And these clinics provide care to veterans who need a little more service than can be provided in the basic clinics, but they don't quite require the inpatient rehabilitation care. So these clinics have a designated low vision optometrist and a low vision therapist who are able to provide a comprehensive low vision evaluation. They can provide a visual skills assessment, low vision prescription or low vision device prescription and training, including any type of electronic devices. In addition to the services in the intermediate clinic, the advanced clinics also have an orientation and mobility specialist who can provide some training in mobility for patients. There are several types of inpatient rehabilitation clinics as well. The Victors program, usually the patients stay there for a couple of days to a week just to get a little more intensive rehab. The Visor program is a 2-week rehab program that additionally provides some training in communications as well as computer training. And finally, the most intensive inpatient programs are the blind rehab centers. Patients typically stay there for about a 4 to 6 week program, and they're in classes all day long. It's a multidisciplinary program, so they have training in low vision, they have training in visual skills, orientation and mobility, living skills, there's shop classes, they can take manual skills training, as well as adaptive computer training. There's psychology and social work services that are there to support the veterans with individual and group counseling to help them adjust to their disability. And they also have certain 1 to 2 week intensive training programs with the newer technologies such as smartphones, tablets, iPads, or specific GPS type training programs. And these are becoming more common, at least in some of the blind centers. And there's 13 blind centers throughout the country. And typically when patients go to these centers, they're legally blind. So patients are usually referred for a low vision exam by their ophthalmologist or optometrist when there's a loss of vision or some visual function where the patient can't be helped by standard glasses, medical, or surgical interventions. The low vision optometrist reviews the eye health history and the patient's overall health history. They'll take a detailed functional history just to determine how the patient is dealing with things and functioning on a day-to-day basis. They use special distance and reading charts, and eccentric viewing can also be evaluated, and that's when a patient who has more advanced macular diseases or any other disease that could affect their central vision, they may have a blank spot right in the middle of things that makes reading and doing day-to-day things difficult. And we can do some assessments for that. We can find out if having the patient move their eye to look at a different, use a different part of their retina, if that's beneficial. And if that improves their visual function, we may recommend training and exercises to do with a low vision therapist. We also look and make sure that the patients are wearing their best possible prescription with glasses using a special instrument called a trial frame. And we just, even if glasses aren't going to be able to correct their vision, we just want to make sure that they have the best correction in their glasses. Evaluation of tints and filters may help to reduce glare in both indoor and outdoor environments. Visual field testing is done to see if there's any problems with peripheral vision or central vision that are affecting the patient's functioning. And one of the most important parts of the low vision exam is to work with the patient to determine their specific goals for visual rehab. And this is important because each low vision exam is really tailor-driven by this patient's specific goals. So we'll talk about goals for just a little bit. We know that there's a lot of low vision devices that can help maintain independence, and we know that goals for rehab are important to determine what device is going to be the best fit for that patient to do what they want to do. Not all low vision aids are going to work the same for all people. So visual impairment and blindness can cause trouble with all sorts of ranges. They can have trouble with close ranges, intermediate ranges, or distance ranges. So some common goals for close vision might include being able to read books, newspapers, or magazines a little bit easier. They may need to read price tags or medicine bottles, or directions, recipes. Intermediate range goals might include using a cell phone, working on projects around the house or working in a workshop, or even working on crafts, playing cards, or doing board games at home. Some distance vision goals may include watching TV, looking at things at the theater, going to sporting events, even seeing menu boards at a restaurant or street signs. So once the goals for the low vision exam are determined, then we'll spend a lot of time trying to evaluate what will be the best optical or electronic device to meet that particular goal. So for example, for reading, a patient may need to use a stand magnifier or a closed-circuit television. To see TV or to see things at a sporting event, they may need to use a telescope or telescopic glasses. The low vision doctor will also evaluate the ocular health. Patients are usually still followed by their ophthalmologist, and we recommend that too, that they're seen as recommended by their optometrist or ophthalmologist to continue to monitor their eye health. But we'll review what disease they have, we'll provide education. Sometimes patients know they have the disease, but they don't really understand how it affects things. So we'll review that with them. We'll provide education on any of the recommended magnifiers or devices that may be needed. And then patients may be referred for further services. They may be referred to a low vision therapist to provide additional training with the magnifiers and devices that are recommended, or to do additional assessments such as Amy mentioned in her discussion. Patients might be referred for orientation and mobility to evaluate and teach the veterans to travel independently and safely. And if a patient has more complex goals or needs, or if they're even legally blind, they may be referred to one of the inpatient low vision programs that was mentioned in the previous slide. So now Kurt will talk a little bit about working with legally blind patients in our VIST program.
Good morning, everyone. How you doing? Good, good. So I'm going to talk about two things today. I'm going to talk a little bit about VA healthcare as a whole, and then my job as the Visual Impairment Service Team Coordinator. But before I get started, can I get a raise of hands from those who are veterans? All right. Quite a few. Can we give them a round of applause? Thank you. Now, can I get a round of applause for those who know someone, like a relative or a neighbor who's a veteran? Yeah, quite a number of hands. So that's why I want to speak about the VA as a whole first off. So the VA is broken into three parts. There's the Veterans Health Administration, which is the hospitals. There's the Veterans Benefits Administration that deals with the benefits such as service-connected disabilities and pensions. And then there's the national cemeteries. We obviously work at the Veterans Health Administration at the hospital. The VA, a lot of questions we get about VA care is, if I have a doctor in the community, can I have VA care if I'm eligible? And the answer is yes. And that's called VA dual managed care. So you have your community provider and then your VA doctor as well. The most important thing is just making sure the left hand knows what the right hand is doing. You may have seen in the news the past couple days that the Affordable Care Act and Obamacare is now open, the marketplaces. For veterans, the VA fulfills that requirement, so you don't have to pay that tax penalty if you are in VA care and that is your only care. So it's important for veterans to know if they're struggling to find out what's the appropriate health care for them. And then for a lot of veterans, the question comes down to medications. And depending on someone's income level, if they're eligible for the VA care, they may have either free or low-cost medications. So that can be a huge benefit for a lot of veterans that we see. Unlike traditional HMOs, the VA provides hearing aids, eye exams, and programs to support veterans to remain in their homes as long as they can. And I think that's very important with the population especially that I work with. As I said before, eligibility at the VA and VA benefits are generally income dependent unless someone does have a service-connected disability. And the co-pays vary based on someone's income and or their service connection, or if they have a service-connected disability. If you have any questions about if you're eligible for care or can I get into care, I put a number on here, and that is the number to our main social work office that you can contact to get a hold of us and to start seeing if you are eligible for care. So a little bit about the program that I run. It's the Visual Impairment Service Team Program. I'm a team of one essentially, but of course I work with Dr. Brahm and the Low Vision team as well. So we are part of the National Blind Rehab Services. My program focuses specifically on veterans who are considered legally blind, so that's 2150, 2200 acuity or worse. Dr. Brahm sees about 600 low vision patients, and I work with about a quarter of those, so about 150 veterans at our VA. So my job, I'm a social worker for our blind veterans. I'm a point of contact for them. For those of you, all of them that are in the military, they know it's a large system. They know that there are a lot of things that worked well in the military, and there are some things that didn't. The VA is similar. There are a lot of things that do really well in the VA, and sometimes there's a squeaky wheel. So my role is to be maybe the grease for the squeaky wheel and to make sure you have a point of contact to say, who do I contact for X, Y, and Z, whatever it is. I help veterans enroll in VA healthcare. So Amy Werf, who spoke, she's made a couple referrals to me, and some outside resources make referrals for veterans who actually are not eligible for VA care. But because they're legally blind, they can become eligible for care. So that's a pretty amazing thing for a couple of our veterans. If they were not legally blind, they wouldn't be eligible for the care we provide. I work to provide some basic adjustment counseling, so starting to talk about the changes. So what's going on with your vision? How does that affect your overall life? We hear about magnifiers and lighting, and those are all great things. But also, how's that affecting you mentally? How's that affecting you day to day? I don't provide full mental health counseling, but we do have a wide array of full mental health counseling that I can refer you to if that seemed more appropriate. I do make referrals to both other VAs, like our Milwaukee Advanced Low Vision Clinic, if there are some needs that we can't meet at our VA here in Madison, and community resources. So all the people that presented up here today, we can refer to them for services. Dr. Brahm also talked about the Hines Blind Rehab Center. That's down in Hines, Illinois. I make the referrals for our legally blind veterans to go down there. As she spoke, it's about a 4 to 6 week program down there. I've been down there to see what they do and visited, and it's unbelievable. Most veterans that come back say their life has been changed, so it's really amazing. And then, like I've spoken today, I provide education for veterans on benefits they may be eligible for because they're legally blind or for something else that may have happened while they're in the service, really giving them that full spectrum of benefits care so that they're getting their maximum benefits by being a veteran, and that's really important. There's a lot out there. And I put my contact information on here, so if you do have questions related to yourself, to a neighbor, to a friend, or you get a letter from your eye doctor that says you're legally blind now and you're a veteran, give me a call and we'll start talking about what we can do to help you out. Thank you.